Okay, welcome back. Next, we're going to take up an overview, sort of the high level view of the Budget Adjustment Act. And I've asked Emily Byrne from the Joint Fiscal Office to join us. Joint Fiscal Office, as you might recall from our little overview, is the pink lady right across the parking lot from us. And we I'll just say it again, because sometimes we need to hear things multiple times. I know I do. We have a lot to do in an intersection with the budget because the Agency of Human Services, as you just heard from Secretary Samuelson, is the largest component of the state's budget. So we have a lot of jurisdiction in that area. And so the Appropriations Committee likes us to provide to them recommendations and our assessment, essentially, our opinion from a policy perspective about what is being proposed by the administration, either in budget adjustment and in also in the FY26 budget, which we won't see for a few days yet. But Emily is graciously, on short notice, agreed to come provide an overview that she also did for appropriations. So, Emily, we're just going to take a quick, so you just know who's in the room because we got a lot of new people this year. You know me, Teresa Wood from Waterbury, also serving Bolton, Buellscore, and Huntington. No, go to the right this time.
Dan Donahue, Northfield, and serving Berlin.
Hi, good afternoon. I'm Dan Noyes. I represent Woolkit, Hyde Park, Johnson, and Belvedere.
Doug Bishop, representing Colchester and 20 districts.
Brenda Steady, Milton Westford.
Todd Nielsen, represent Brandon Morris.
My name is Zon Eastis, Guilford and Vernon.
Esme Cole, I represent Hartford.
I Jubilee McGill, Bridgeport, Weybridge, Middlebury, and New Haven.
And I'm Ray Garofano, Essex and Essex Junction.
Emily Fleury, committee assistant.
I'm Katie Selena, Let's for Kids. Beverly Bogat from the Vermont Early Childhood Advocacy Alliance.
Great floor is yours, Emily.
Sure. So I'm Emily Byrne. I'm the deputy at the Joint Fiscal Office. I've been there for a little over 2 years. And my role is I help sort of coordinate the whole budget process. And part of the budget process includes the Budget Adjustment Act. And so I have a presentation that luckily for you, I've given twice already. So hopefully
Got it down?
So I will walk through, and this is not intended to be like what is in the actual Budget Adjustment Act the administration put together. I will sort of probably use some examples that they put together, but this is sort of why do we have a Budget Adjustment Act? What does it tell us? And what things to think about in the Budget Adjustment Act. So we'll share my screen.
And this is on your on the committee's website as well.
It is.
Want to look at that a little closer.
And feel free to jump in with questions. I'll do my best to answer them. If not, I will get back to you, of course. So the Budget Adjustment Act. So I think the Budget Adjustment Act is adjusting the current year budget. So for this current budget adjustment is for the fiscal FY25 budget that we're currently spending money and collecting revenue for today.
FY25 started when, Emily?
FY25 started on July 1st, 2024. So what's nice about the legislative session is the year of the actual calendar aligns with the fiscal year once you guys come into session, which is handy. But then we will be building the 26 budget starting in 2 weeks, I think, when the governor brings it to the General Assembly. And that will start next July 1st. So the budget adjustment, first to sort of frame out the budget adjustment, it's important to think about sort of the timeline around building the actual budget. So as a reminder, the governor signed the fiscal year 25 budget into law back on May 23rd of 2024. So that was about 6 weeks prior to the actual commencement of spending the FY25 budget. Wrong way. And so if we go back a little bit further, the governor presented that budget to the General Assembly back in January of 2024. So 6 months prior to the start of the FY 2025 budget. And sort of going back even further, budget instructions for the 25 budget were issued on August 31st to agencies and departments back in August of 2023. So this is a long process, and to sort of use the sort of butterfly as an example, but right, things change over time, right? It has been 18 months since the sort of commencement of the building of the last budget. And a lot of things change as that goes around. Just remind everybody, right, a budget is just a plan, right? It's how the state plans to spend its revenues and based on estimates about what's going to be available in any given fiscal year. There's a lot of assumptions that go into building any budget, right? Even your home budget, and you can imagine the state budget. There's a lot of things that we have to, I don't like to say guess, right? But we have to assume, we have to estimate when we build the budget. So you may recognize these two. This is Tom and Jeff, the legislative and state economists. So on the revenue side of the picture, the emergency board meets twice every year. They met in terms of the context of the FY25 budget, they met on July 31st of 2024 and adopted a new revenue forecast for the general fund. So the General Assembly passed a budget that was based on the revenue forecast adopted in January. It got updated about 2 months after the General Assembly finished the budget. And that resulted in approximately $172 million of additional revenue in the current year that's sort of available, forecasted to be available for appropriation in the current year. So that is a pretty significant, revenue increase in any given year. But it's available. And this will change again before we finish the legislative session. So the emergency board is going to meet next week on the 22nd. They're going to adopt yet another revenue forecast, which will change what the revenue picture looks like in the general fund.
And Emily, when they do that next week, that will be for 2025, but will they also be forecasting for 2026?
Yes.
Yeah.
So
Okay.
they will give us both the 2020, a new number for 2025. So the governor's budget adjustment that he presented to House Appropriations at the end of last week was based on the July forecast. So there'll be a new forecast and there'll be some negotiation around if that goes up, if that goes down, what happens with the governor's budget adjustment next week.
Representative Bishop.
Does our work on the Budget Adjustment Act wait for the results of the January 22nd meeting? No.
No. And after we're done here, I'll give you some timelines that I got yesterday.
And so just as, a reminder, the emergency board both adopts the revenue forecasts for the general fund, tax sources to the tax sources to the general fund, so the general fund revenue forecast, but also the non-property tax sources to the education fund, as well as the transportation fund revenue. Also on the revenue side, right, we have more, and they also forecast, I should mention, especially for this committee, the payroll tax receipts. And we've only got, a couple months of experience with payroll tax receipts, but the emergency board as part of the revenue forecast also includes that revenue estimate. And so generally in the budget adjustment, and we actually are, there's a lot of these tweaks in the governor's budget adjustment, but we have more experience with special funds. We have more information about what revenues are coming in, what's coming in higher, what's coming in lower, and whether or not adjustments need to be made accordingly to appropriations made from those special funds. One you will see this in is the child care special fund, as an example. So additionally, things change related to expenses, right? So I mentioned the budget's built making a lot of assumptions, right? We have to sort of gaze into the crystal ball and try to figure out what we think spending is actually going to be.
I've never seen you use a crystal ball.
You don't know what's over the pink lady. There's lots of tools in the pink lady.
It's going to be repainted, but it will forever be.
So an important one that comes up, right? So we assume caseload and enrollment estimates and things like the Medicaid program and things like childcare, and adjustments are made based on, what the trends are actually looking like in terms of who's showing up for those programs. And how much it's costing. I'd throw this in there for the appropriations committees, right? Like in the transportation space, they have to think about like, how much do we think it's going to snow next year? How much overtime do we think we're going to have to pay snowplow drivers? And it's anybody's best guess whether or not it will be a lot of snow or not a lot of snow. how Vermonters are utilizing of a government services. So, right, how many people not only are enrolling in programs like Medicaid, but how they are utilizing Medicaid services. And there's, changes in those trends, and it's looking like, well, caseload is level, utilization is up, right? And it's costing more, not because there's more people, but because of utilization of services. Have to make assumptions about whether or not there's going to be a flood. You have to think about what's sort of going on generally in the economy, what's happening with wages, what's happening with unemployment. Thinking about things like the price of gas, where we have agencies and departments that have to either drive snow plows or like state troopers, right? Making assumptions about how much that's going to cost so people can do their jobs. The cost of the state employee benefits programs. For example, there is a change in the budget adjustment related to state employee healthcare costs and making sure that a fund is shored up. The rate of inflation, right? It's anybody's best guess what inflation is going to do in the next 12 months. And so we have to make some assumptions about how that's going to impact general costs in everybody's budgets. And we could keep going forever.
One of the things that makes me think about this is it impacts how much we spend, and it's had a recent change is the federal FMAP, the Medicaid, not what all the acronym stands for, but it's the matching funds essentially from the federal government. In this committee, since so much of the work that we have is Medicaid, when the federal share goes up, our state general fund goes down, that creates some availability of general fund, if you will. And so, but it also goes in the other direction, depending upon the economy and the formula that's used. But that again is not something we have control over.
Right. And we get a projection for it, and then it gets finalized in the fall. So we have to use the projection in the budget, and then we true it up in the budget adjustment based on what the actual rates are going to mean. Because the federal fiscal year is not July to June, it's October to September. It's all kind of funky. But and I sort of touched on this. This is the magic 8-ball.
Later.
And so, right, our assumptions and estimates used to build the budget are typically wrong, right? Like I've had to explain to a lot of people, right? We do our best estimates, but people who build budgets are kind of like weathermen, right? We have a lot of important data. We use all that data to do the best estimates, and we're usually pretty good, right? Like, and I think that's an important, someone made this point yesterday, right? Like $1 million is a lot of money, but when you're talking about $1 million on a $2 billion budget, that's pretty good, right? So there's, put some of that in perspective, right? Yes, it will be wrong, but it's sort of the magnitude of how off things are that's important to keep in mind. So, but estimates are estimates, assumptions are assumptions, and they vary, right? So there's either more or fewer people enrolled in programs in state government. It snowed more or less than we thought it would. More or fewer people utilized government services. This one, there was a flood this year, right? We didn't budget for there to be a flood, but now we're going to have to make some adjustments accordingly. Something happened in the economy, right? Like, we thought it would be this, it turned out to be that. And so now we have to react to it. Price of gas was different than what was assumed. The employee healthcare costs were more or less than what we thought they were going to be. In this case, it's more than we thought they were going to be. The rate of inflation is different than we assumed, or the rate of how it's changing is different than what was assumed. Again, list goes on. And so there are other things that we often hear about in the budget adjustment. This is probably more for the appropriations committees, but it's important for everybody to hear just because it's good context generally for what's going on in the Budget Adjustment Act. But there are receipts that aren't meeting projections. So an example in the current budget is we made some assumptions about how the sports betting revenue would come in, and it turns out that it's less than we anticipated. So there has to be an adjustment based on.
Not because people aren't betting, because they're winning.
What I heard.
I guess, it seems like a double message, maybe, I'm not sure.
Yes, but so that's adjustments for those things. The cost per case is increasing or decreasing, right? We're seeing that in Medicaid as the cost per case is increasing over what was in the initial budget. Projections are not met. So this can either be on the expenditure side or on the revenue side. Unable to hire staff. We hear this in some agencies and departments, and then it's also within some other areas. I know in the healthcare space, just sort of where travelers are being deployed, traveling staff versus regular staff, and how you have to manage that. Projects started late. So often we make assumptions about when we're able to get a project off the ground when we build the budget. and maybe it started late, so there's some savings associated with that because the contract doesn't have to start until later than anticipated. Savings weren't realized. There are some areas in the budget where we hoped that a policy lever may generate some savings, and then maybe it doesn't work out that way. I don't have a good example of that one off the top of my head. But similar to sort of projects starting late, right? You issue an RFP, and for a project, and you assume it's going to cost a certain amount of money, and you put out the request for proposal, and all the bids come back higher than you anticipated. So the only way to complete that project is to have a budget adjustment accordingly, or they all came in lower and you have some savings associated with the contract. A lot of times in the budget, we try to do our best to make sure we put the money in the right place in state government and within the right appropriations, and sometimes we get it wrong. Or sometimes the departments go in and, oh, that shouldn't have been in FSD, it should have been in CDD, for example. So there are net neutral transactions that are happening to just get spending authority in the right place.
I might say for the budget teams that there's quite a lot of that in the Agency of Human Services. So unless it looks like totally out of whack to you for some reason, you don't really need to spend a lot of time on those things that say net neutral.
Finance and management and AHS do a really nice job of like explicitly putting in their explanations, and you should be able to track through the ups and downs. Like there's one and there's the other. Okay, we're all good. The SLA agreement changed. This one is more sort of internal to state government, but the service level agreements are between agencies and departments in the Agency of Digital Services. And there's a lot of.
Since you mentioned the Agency of Digital Services, is there more information coming about that? I mean, there's a lot of increases in the ADS, Agency of Digital Services, charge back to departments. I mean, like, if you add them all up, it's big.
I know House Appropriations is going to take testimony from ADS.
Yeah, okay.
Get some more information on that. But that's sort of underlying in a lot of places in the budget. Another one that we sometimes hear about is vacancy savings weren't realized. So a lot of times, right, there's a lot of churn within agencies and departments in terms of people coming and going. And if they're, somebody retires after 35 years and you hire in somebody that's younger, right out of college, their salaries will be different. So there's a lot of, movement within state employees. There's assumptions made about what's going to be vacant or not. An example of this, I don't think it's within this committee's jurisdiction, but I'll use as an example. In the budget adjustment, the Human Rights Commission had a budgeted vacancy savings, but they are fully staffed and anticipating being fully staffed through the remainder of the year. So they are not going to realize the vacancy savings that they thought they would. So there's an adjustment to make sure that they have enough budgetary capacity to pay all of their staff for the full year. So all of those things are changing. There's all of these assumptions, and that's where the Budget Adjustment Act comes in. Often it's talked about as the BAA, the A being for the act, even though it's not an act until you actually adopt it, but we call it the BAA nonetheless. Last year was Act 87, right? It's a mid-fiscal year opportunity to make updates to the current fiscal year budget. It's the sort of opportunity to appropriate those new revenues or the other direction to make adjustments downward in the event the revenues aren't performing, and to address those unplanned expenses across state government. It's meant to be in a technical adjustment to the appropriations, sort of based on updated information that sort of try not to put policy into the Budget Adjustment Act. Sometimes there are things that need to happen, for timing reasons, and the Budget Adjustment Act is the vehicle that ends up going in. A lot of times it incorporates changes that are outlined in the letter of intent. The letter of intent is drafted by the chairs of the appropriations committees to the administration to provide clarity on areas that weren't perfectly clear in the budget that's passed. So there may be a little language tweak that needs to happen. The intent letter sort of acknowledges this is what the conversation was in the committee and in the General Assembly. Please make the following changes in the Budget Adjustment Act. So there's a couple of those throughout the governor's proposed budget adjustment. And it's really right when you get to the very end of it, there's, we have an opportunity to update things after the House passes the bill, after the Senate passes the bill. But after the conference committee writes their report, there's really no opportunity to tweak anything. So this is the letter of intent helps address some of those issues, and then they get adopted in the Budget Adjustment Act. So, and these links should be live in the electronic version. So if you want to read it, go for it.
Why don't you, can you link to the addendum? Because that's one that,
Yeah.
just sort of highlights something that happened, for our jurisdiction. Open.
Stop sharing and reshare.
It's not.
Yeah.
All right, I
Live
can,
thing.
I can send one that should look at it, see if we can get Grady on it. So this was the addendum to the letter of intent. So we thought we had caught everything, and then we found there was actually one more thing that we needed to issue guidance on to the health department. And I can speak to it mostly, but it's easier to look at the actual language. So in the budget, there was an appropriation of opioid special funds to treatment sites, and there was sort of a discrepancy, a question from the Agency of Human Services. So there was the 1.5 million. Was that supposed to be divided between 3 or 4 opioid treatment centers? Because in subpart 2, there's $500,000 that was going to go to the Howard Center in Chittenden County, and the intent was that total of 2 million go to the 4, and the 1.5 is split between 3, and then the fourth $500,000 was, had a little bit more direction in terms of how the Howard Center was supposed to use it. So there was some confusion about whether or not to divide the first, 1.5 by 4 or by 3, and this just clarifies the total is 2 million. This is how you allocate it, and this is in the Budget Adjustment Act.
So that's an example of something that would go in the letter of intent.
Yeah.
Thanks.
I think I only have one more slide. It won't move. There it goes. So the timeline, right? So the budget adjustment is usually presented early in the legislative session. There have been years in the past where in the second year of the biennium, the administration presents it in late December to the House Appropriations Committee just to sort of get things moving. It didn't happen last year, but it will likely happen this year. It's typically one of the first bills that the General Assembly passes because it impacts things happening today. And there's often like timing needs with spending authority and other language changes. It's important to note that it's not the last time that the General Assembly adjusts the current year budget. So there's the C section. So the budget has sections, lettered sections. The C section in the big bill, the Appropriations Act, is where the General Assembly makes further changes to the current year budget. So sometimes we learn even more. A good example of this from last year's budget was so in April is when we learn whether or not the personal income tax is going to be sort of under or over forecast, and everybody kind of April 15th hits, and then we really find out sort of how that's going to track. Last year, April came around and turns out we were likely going to have a lot more revenue than we anticipated than forecast. So in the C section, what happened was the sort of contingent appropriation list. And that's where that will come in, is right. That was sort of current year money that was coming in, and some decisions were made around that. And that ends up in the C section of the budget. And that's all that I have generally on the budget adjustment. I don't know if there are any specific questions that anyone has about the BAA or anything you may see coming in the BAA.
Any questions? Do it.
You have a question?
No. Be well.
Don't worry, you know it quite do. Representative Steves and then Representative Noyes.
Thanks. I'm not sure I understand the C-section. Does that happen after the Budget Adjustment Act?
Yes.
And so there's still one more time when things can be adjusted?
Yeah.
Okay.
You'll see the C-section in the FY26 budget.
Oh, it becomes part of that
It
budget.
becomes part of the
But it's
FY26.
looking
budget
backward.
act.
I see.
It's looking backward, exactly. Representative.
So just looking at the budget adjustment that was presented to the Appropriations Committee. It's in a spreadsheet. Across the top is all the little GA, SA.
For the funds, yeah.
Special funds,
Could you
yeah.
run through those?
Sure. That's a thing I can answer for sure. And you want me to share it?
Yeah, sure.
That would be great. Because when you first look at it and you're looking at all those lines, it's It's hard to determine what they're
Yes.
talking, where the money's coming from and where it's going.
Going, right.
The other thing that Emily might be helpful is to show them where on the JFO website. So you can find some of these documents in multiple places. You can find them through a process on the appropriations website, but they're actually all in one spot on the JFO website. So yeah, great. Just need to be bigger.
Yes. The one thing that's tricky. So actually, let me show where on the website you can find everything. So if you go to the JFO website. So if you go to the JFO website under subjects, you'll see appropriations and budget. Go in there. So now one thing that I have to remind myself, right, we're talking about the FY 2025 budget adjustment. So if you go into FY 25, the first thing that you'll see is the the documents that the governor presented, or the finance and management presented on behalf of the governor to the appropriations committees. And then when the House has finished up its budget adjustment, sort of above this, we'll show the House documents and then the Senate documents conference committee, and as passed, we'll sort of build from there. But this is the place to start for that. Again. So this is what they sort of call the budget adjustment worksheet. And this runs through, so down the left are the sections of the budget and the departments that are impacted. So that's where you find who's impacted. And then across the top are those funds. So this is what you're talking about? Okay, great. So general fund, the first three we know: general fund, transportation, education fund. Special funds, this aggregates all of the special funds across state government. So there are 400 of them. Or about thereabouts. Yes, there's
So the childcare is
The
tied to a special fund.
the opioid abatement.
Okay, yeah.
Tobacco fund. Can you think of other ones off the top of my head?
Those are all by statute.
Well, yes, most of them. Then we have federal funds, dedicated funds. These ones are
Is that's federal funds, non-Medicaid federal funds?
all federal funds. So it'll be the match for Medicaid. So what you'll see, I can go down and show you sort of how
Okay,
the AHS transaction will work on this sheet. Dedicated funds are the like the trust funds for the pension. There's usually not a lot of activity in those in the Budget Adjustment Act. The Global Commitment Fund, so that's the mixing bowl for Medicaid, so where you have both the state and federal match being appropriated to AHS agencies and departments. Other funds, I should remember what the other funds versus dedicated are. No, there's a footnote.
there's a footnote.
Oh, handy
Yeah.
that is. Footnotes.
That's okay, that's all right.
9 pages away. It's gonna bother me if I don't.
All right.
Special funds, there we go. Tobacco, fish and wildlife, et cetera. Debt service, the pension trust fund.
Internal service funds.
Oh yeah, internal service funds and interdepartmental transfers. There will probably be some activity in those. And total, yeah. And then to answer your question, if we go down to AHS, we'll see, so in the mixing bowl appropriation, AHS global commitment, we have this is the general fund column,
Mhm.
and then over here is the federal fund column. And then if we go to like a department. Here we go, global commitment fund, I believe this is DEVA, right? There's the DEVA appropriation for, out of the global commitment.
Have a global commit fund, okay. Representative Weiss, did you have something else?
Well, yeah, if you look at the ups and downs page that was presented to the appropriations committee yesterday, because usually work off of that one.
Mhm.
There's a couple other ones up there like IDP capital T.
IDT, yeah, interdepartmental transfer.
Okay, those are the transfers, federal
Yeah.
funds, Medicaid, investment general fund. Okay. I just had a question about that. Thank you.
Representative Bishop,
And thank you. For the federal funds, that's the non-mixed Medicaid funds and the federal transportation dollars?
Yeah, I'm trying to remember if transportation fund if it all goes into the transportation, no, I think, no, it's federal transportation dollars, all the federal funds. Agency of Education gets federal funds,
Right.
everybody gets federal funds, and that comes through that federal fund.
Okay.
Other questions on that? Great. Thank you so much, Emily. Appreciate it a lot. Emily's a great resource, and
Yeah.
Feel bad.
I'm very appreciative of the fact that you jumped over this afternoon. I appreciate it a lot. And so this is meant to help you with sort of understanding the next things that you're going to be doing. Okay. Let me just talk a little bit about time frame. So yesterday I learned that the Appropriations Committee wants our recommendations by the end of business on 2/23. That's next week. Okay. Yes, that's real.
Next Friday?
No.
23rd is what?
Thursday.
Thursday, so a week from today. Okay, so, and what that means is that, you know, we need to work quickly and you're gonna need to have some time offline to be able to work on this. And there are changes in each one of the assigned areas that we have. There's some big changes in Dale, there's some big changes in CDD, there's some CDD, sorry, wrong one. And then family services, health department's got stuff. So there's a lot of stuff going on. I would encourage you to look through the language and don't think if you're just looking at AHS that that's the only place you need to look. That's not the only place you need to look. So there, what I will try to do, I don't know if I'll be able to do it between tonight and tomorrow, but I'll try to highlight the areas that I want to make sure that you ask about in your specific department. So there's things like creation there's quite a bit of stuff going on around childcare financial assistance program and some big money there, and creation of a special reserve, which I don't think as a policy is a bad thing, but we just want to make sure we know what's going on there. In Dale, there's $40 million for nursing facilities. That's a very large chunk of money. And, you know, we need to take a close look at that. So every department's got something, every team has something to be looking at here. And so we're going to need it. So if we think about planning backwards, if we have to have that close of business on Thursday, we'll be talking about this. We're going to have to kind of do this in a compressed point of view. We'll be talking about this in committee for your recommendations to make to the committee on Wednesday. Okay, so your teams need to be doing the work that you need to do to be prepared to talk about them in committee on Wednesday. Yeah, Ann.
Are we gonna have soon, like the big picture walkthrough from the agency of all of our departments?
Well, let me ask a question about, so all of those materials are available on the agency of, on the Appropriations Committee website. So we can have AHS come in or have the three departments come in and do a walkthrough of what they've already done in appropriations. That's one option. Another option is to look at the testimony from that committee. I'm just thinking of the compressed amount of time that we have, and being able to schedule those folks at the same time that we still have a lot of orientation stuff to be scheduling, and then we have to get the memo. So my preference is for individual teams to look at the stuff at the appropriations website. Each department has done it, has presented there and is in the process of presenting. And I'm okay also if one of your departments is not presented yet for you to take a look, and if you want to go down and listen to the testimony live, that's okay with me as well. But you can find it on YouTube, so you can actually listen to what they say that their presentation is. The disadvantage is we don't have the opportunity to ask questions live.
But that's how we do it as follow-up.
Right, that's the sort of the background and research that you do prior to meeting with the department so that you can ask the follow-up questions. Okay? And I'm here as a resource for you. And I'm just letting the Dale team know that I'm probably going to want to talk with you about, the Dale stuff. Just as I used to work at Dale and,
Work in.
no.
She ran Dale.
No. So, but I think it's, and I think that there are, a bunch of questions for us to think about in CCFAP. It's a relatively new policy. There's increased revenues and there's less than expected expenses. And so there's, both sides of the equation are creating a potential surplus there, but what we do with that surplus is a question. And so we'll have all those discussions, okay? Opioid settlement money, is that money getting out the door? Is it doing what we thought it was going to? All of those kinds of things. So as you look at that background information on the Appropriations Committee website, and your lead team member should be able to help the new members find that information, because they've all done it before, with the exception of Representative McGuire, who was on a different committee last year, but I'll help out, I'll help out you folks on health department. So I can do that actually when we get off, and I can show you. And is there any questions? So key dates, Wednesday. So this is for us, Lori, sort of, agenda planning.
I'm ready.
Yeah, I know. Wednesday, we will need to have committee discussion, and you'll be making your recommendations. So that means you'll need to work with your committees. You may need to work some on Monday. I'm just letting you know that, depending upon availability of the people that you're working with. And I know all the advocates are listening and their representatives are listening. And so you'll be hearing from them as well. Okay. And you'll reach a point where you have to say, I need to make my recommendations, and that's it, And this isn't the FY26 budget process. Remember that. This is just making adjustments. And so just kind of keep that in mind. Okay. Yeah, Dan.
Is your plan to schedule committee time early next week to allow us to meet with people from the department, so that I could potentially send out an email today to say, hey, Tuesday morning, after floor, before floor, to be able to just meet?
Yeah, just a second. What do we have, Lori?
We don't have that training after floor on Tuesday. That's Thursday or sometime.
So it's Thursday. Okay.
We have witness testimony from 1 to 2:30 on Tuesday.
And so you should have time after caucuses.
Mhm.
Okay, because the floor time on Tuesday will be short. You'll have time after caucuses and during that lunchtime. And you'll also have time on Tuesday after our official committee meeting. So from 2:30 on, so later in the day, you'll have time on Tuesday. And we have time tomorrow afternoon, I believe,
I
too.
was gonna ask.
Yes,
Yes, I believe we have time tomorrow
I have nothing
afternoon.
scheduled.
Yeah, so tomorrow at, I did, I know, isn't it amazing?
Yeah, you know what?
So tomorrow afternoon is a time that I would suggest that the teams meet and review the materials that are on the appropriations website, so that you can schedule time, hopefully on Tuesday, maybe Wednesday morning, or Monday if you need to, with the departments. So, and just remember, don't get too bogged down in trying to do everything. You're just looking really at the major changes. We'll have an opportunity to look at everything when we look at the 26 budget. Okay, so just keep focused on the changes. All right, and we do have some things that people are bringing forward that we may want to consider that actually don't cost any money. That's bonus, right? Those are things that we'd like to be able to do. So
Do folks know that if you want things printed, send it to Tony and the copy room?
oh, there you go.
You
Good
want a
point.
big spreadsheet, the worksheet, or maybe just find the pages that apply to your section of the budget. And his email
I think it's copy room.
copy room.
Leave it to you and take care of us.
A lot of people need things like, when you're looking at a budget
You wanna
spreadsheet.
highlight or make notes.
I'll go with my teammate. I'm a paper person, but I'm adjusting.
Yeah, we can talk.
I can adjust.
Yeah.
Sure.
No,
No,
not
no.
Do like personal stuff.
Correct, again. Again,
We'll meet after the floor.
we don't have anything after
Yeah.
floor today, and floor is going to be short today, so this is also a time for you to meet with your team members. And Don, why don't you and I touch base a little bit then as well? I'm going to meet with Doug for just a couple of minutes, and then I can kind of like show you how to navigate that.
I'd appreciate that very
okay.
much. Thank you.
All right.
Last question about schedule, Madam Chair. Looking tomorrow after floor, we have a legislative council overview. And then we're going to do some additional budget adjustment act conversation, or is that kind of free time for us to work with our team?
Where if it says committee discussion, that was just a placeholder. That you're gonna have, we're not gonna have committee discussion until next Wednesday. So it's gonna be time, if you see right now, if you see BAA committee discussion, that means you have time individually to work with your,
Would it be safe to assume that legislative council overview is going to be relatively brief tomorrow?
I think they said 40,
40.
well, an hour and a half we have scheduled,
No, that's next week.
Oh, that's next
This
week.
week's is like an hour, 45.
45,
This
yeah.
week is just the overview.
So
Next
plan
week is
for an
the-
Oh, let's get, next week's that, yeah, okay, so it's just
plan for an
45,
hour.
yeah.
A lot of time tomorrow.
Yeah, so, and we purposely did that because, one, it's, scheduling time with the administration is also tricky. So, and if you have problems scheduling time with the administration, please let me know, okay? And I'll do what I can do to help. And Brendan Atwood, who was sitting over here, is, actually also a great resource, and he can rattle some chains. Okay, any other questions about that? Okay, great, we can go offline, Lauren.